So you've lost your job. Did they say to you, look, all you have to do is have the jabs and you can still work here?
Oh, yes, they made that clear earlier in the year, that this rule was going to come into place on the 11th. So we have admittedly had plenty of warning.
Tell us why you took this decision, Louise.
Because I don't trust it yet. I don't think it's been around long enough to have enough good evidence and data come back to make me want to get it. And I don't understand how it's only been made mandatory so far, and first off, just with care staff in care homes. I would have thought it would have been mandated throughout the NHS first, because they are the ones that are, working front line with COVID patients in the hospitals. So, why skip them and go straight to us? And why not mandate it for the residents and the visitors? The visitors that are coming into the buildings.
Sure,
why only the staff?
Sure. Well, the answer is, I guess, that they're trying to see whether this works in the care system to up the number of people having the vaccination, and then they're going to do it in the NHS. And obviously you would disagree with that. And I could see how upset you were in that film, Louise. You love your job.
I've lost sleep over it. I've cried so many tears over it. It's absolutely heartbreaking. And it's not just me. Apparently there's over 60,000 of us that stand to lose our jobs because of this, because we don't want this vaccination that is still classed as being in trials till 2023. I'm not an anti-vaxxer. I'm not saying I'm never going to have it. I'm just saying I just don't trust it yet. I'd rather wait, and so would so many of us. And this is just so unfair. We was good enough to work through it in the beginning.
Yeah, I hear you.
And now it's like we're not good enough all of a sudden. We was there while people were, when we didn't realise what COVID was, when none of us knew what any of this was about. We was the ones still going out to work every morning, dealing with this, putting our own lives at risk, for all we knew. I had my son begging me not to go to work because he thought that his mummy wasn't going to come home, and it's just upsetting to know that all of that, everything that we've sacrificed and everything that we've done is just disregarded.
Well, we've got Benjamin here and Emily listening to you. Benjamin, what do you say?
I mean, look, watching, knowing how much you love your job and seeing you crying, my heart sinks of everything about this situation. But ultimately, you are wrong to refuse the vaccine, in my opinion, because more than 100 million doses of this has been issued in this country. We know very clearly that it is safe and that it works and that it saves people's lives. And the reason that it was so important that this was put in care homes first is because anybody who was in a care home living there is by definition vulnerable. And you said that the reason you've chosen to wait, as you put it, is because you're not sure if it's safe. Well, I tell you what, if the rest of us had made that decision and not got the jab, then a lot more of your residents would have died and we would still be in lockdown.
Louise, what do you say to Benjamin?
No, I don't agree with you whatsoever. I don't think it's proven that it is working and that it is completely safe. There's been well over 1 million, I think nearly 2 million adverse reactions being reported on the yellow card scheme. I just know from personal experience as well, talking to people, how it isn't working. Even Boris Johnson himself has admitted it won't stop you catching it, it won't stop you spreading it. So what's the point?
It saves your life. It saves your life, and we know that. And it's wrong to claim that it doesn't vastly reduce the chances of you surviving COVID, of you not getting long COVID, of you not getting seriously sick. That is evident from hundreds of millions of people who have been vaccinated around the world.
Emily, which side are you on?
I don't think someone's employment in this way should be determined by whether they take a jab. I think it's absolutely right that people can decide based on the evidence that they see before them, whether or not they decide to take it. I think that's absolutely fine. And sorry, I've forgotten your name.
Louise.
Louise, but you're totally right to note that the Prime Minister himself said that this vaccination does not stop transmission. So if Louise is going into a care home and working and helping elderly patients, it is her risk that she is taking fundamentally by not taking the vaccine.
No, it's not.
And I think I'm actually with the unions on this for once. I'm actually with the unions for once, because they're saying this is not the way to treat our care home workers. We shouldn't be giving them ultimatums. We shouldn't be coercing them in this way.
What about,
we should encourage and have a discussion about it. And the pragmatic...
But hang on, wait. If you have a care home resident who either has the vaccine but it hasn't been effective in them, or Captain Tom is the example we always give, at the end of his life he couldn't have the vaccine for various... OK, so, and then Louise looks after that person and she's more likely to have COVID because she's not vaccinated. How does that work?
There's a clear middle ground here, isn't there? Louise, I'm sure, would be happy to continue to get tested if it meant that she didn't have to have the vaccine and would be able to stay working in a job that she loves. How is that not a fine compromise? And let's look at the actual facts here. You know, you've got 97% of care homes already have staff shortages, over 100,000 vacancies in the sector alone. If you remove 60,000 workers from this sector because they haven't had a jab, which fundamentally is for their own safety, is just wrong, and it's going to have devastating effects.
But hang on, you know, first of all, I don't accept that 60,000 people will actually refuse the vaccine and leave. And frankly, I'd rather dangerous people that refuse the vaccine leaving the workforce than vulnerable people dying because they got passed it on. But look, you know, France did this already. In July, they introduced a mandate for health workers, and at that point, 2/3 of them were vaccinated. In October, 99% were vaccinated. The number who actually left their health force, 0.1%.
Well, you're really unusual because, as Benjamin was saying, a lot of people have thought, OK, I don't want to lose my job, I'll just go and have this blooming vaccine. That's what a lot of people have done. But you've really held out, but you've held out on the basis of your stats are wrong, you know, about the adverse reactions. They're not right.
They're not. What's happened to our basic human rights? Why do I not have the freedom to make that choice? This isn't a choice.
But the people you're caring for don't have a choice in who cares for them. They should be... I wouldn't want my elderly relative, I wouldn't want my 89-year-old grandmother cared for someone that doesn't take basic respect in a pandemic.
OK, then, so what if you needed assistance from an emergency responder?
I want them to be vaccinated. It's very clear.